Hi, Dr. Ritesh. Welcome to a new episode of the Genius Dentist podcast. Dr. Ritesh is the co-owner and managing director of Psynergy Mental Health and a principal dentist at Edge Dental Studio in Sheffield. He did his dentistry from the University of Sheffield in 1999. Dr. Ritesh talks a lot about mental health and well-being and is a frequent speaker and panelist at various UK and international conferences. Dr. Ritesh, welcome to the episode.
Thank you so much for your introduction. Really appreciate it. Great to be here. Thanks for having me.
Thank you. No, thanks to you. So can I call you Rick?
Of course you can.
Much easier. Rick. Okay, that's much easier. So Rick, do you want to talk about or walk us through your professional and personal journey, starting from, obviously the dentistry aspect and the second, I shouldn't call it second phase, but the current phase of Psynergy, and what triggered you to start this new venture. So yeah, over to you.
Yeah, sure. I qualified as a dentist in 1999. I went to University of Sheffield from 94 to 99. And, I'm not going to lie, thinking back on my university career, I probably struggled with mental health issues at that point, without really realizing it. Just sort of being a kid that grew, born in the 70s, growing up in the 80s, you sort of just learn to get on with things, and that's how you build your resilience, don't you? You learn from your mistakes and you build up your toolkit to survive, sort of thing. So, but thinking back on things now, I probably struggled as a dental student, but I qualified in 99. I had a great vocational trainee teacher, mentor, as it was vocational training back in those days. And I went on to started my career in Barnsley in South Yorkshire, with a fantastic mentor called Mark Bishop. And I'm pleased to say that we're still very, very good friends to this day, which is real testament to him. I stayed there till about 2002, and then I left the NHS and went to work privately at a practice in Sheffield. And then I returned back to the NHS in 2005 after doing various sorts of advanced restorative courses, which was a massive help to my confidence and my capabilities and sort of belief in myself as well. I'd advise any young dentists out there to invest their time in their education, which majority are doing so now, and get onto these advanced restorative courses, and these sorts of occlusion courses and that kind of stuff, to really sort of get good at their skills, the basic skills as well as the advanced stuff, but also build their confidence in their own abilities. So that'd be a great tip for any newcomers listening to this. From 2005 to 2008, I worked as an associate. And then in 2008, I successfully tendered for an NHS contract, which was quite an interesting phase of my life. I converted a Greggs the Bakers in the centre of Rotherham. So it was a Greggs the Bakers that had been gutted and just left as an empty shell. And I converted it into a 4-surgery dental practice whilst doing my full-time job as a dental associate. And also we just had our second child as well. So it was an interesting period. Lots going on. But when you're younger, you feel as though you can do these things, don't you? So I cracked on with that. That was really good. And then in 2017, I eventually sold that practice. But back in 2011, I bought the practice that I own now, which is a very small 1-surgery private practice. And just sort of rounding up the bits of my career, from 2006 to 2016, I was a foundation dental trainer as well, which I really, really enjoyed that aspect of dentistry as well. So in 2017, I went on to work in my 1-surgery private practice, and that was going to be it then. That was my sort of career for the rest of my life, sort of thing. And then I got myself involved in being a medical tech consultant for a firm, just via some investments that I'd made. And the first job I did was on depression and anxiety. And looking at a new way or a different way to try and treat depression and anxiety, not just using medication. That really fueled a passion within me to look at various ways to try and improve mental health and well-being in general. And through that work, I ended up leaving the first company that I was with. I was the chief operating officer for that company. I ended up leaving that company to set up Psynergy Mental Health, and took some of the novel ideas that I had with me along with my new team now. So that sort of brings me up to present day, I think.
That's brilliant. So that was that experience. So you were in the field of mental health when you were at this CEO position in the early company as well. And so this was, did you start Psynergy, you said, with a team? You already had a team, or was it just friends and family?
No. So it was, it's a really bizarre situation. So just rewinding. So when I was given the offers, the job as COO, that was the first time I'd worked in mental health. And my job was to look at ways to utilize a treatment called transcranial magnetic stimulation, which essentially is a magnet that's placed on your head to re-regulate the electrical activity in your brain. And there's a growing body of research, and a growing body of research within neuroscience in particular, that suggests that dysregulation in electrical activity can lead to common mental health disorders. So we were looking at the treatment side of things. But what they were doing was they were using something called EEG, that's electroencephalography, to measure the electrical activity in your brain, to try and understand which areas are regulated correctly and which are suffering from dysregulation. From that part, I decided to look at objective ways to try and improve mental health assessments. So we brought the EEG aspect to the front end of our assessment approach. So we converted what was traditionally a subjective pathway into a subjective and an objective pathway. I'll explain it in dental terms in a second. I then left that company, and I remembered that my nephew's friend was just qualified as a medical doctor, was studying neuroscience at Cambridge University. So I got in touch with him and said, look, I had this idea of the previous company. I'm looking to try and advance it further. What do you think to the idea? And it was quite good because we met on a service station on the M1 to discuss this. And I went through some of the research we'd done and that kind of stuff. And he was really quite taken by what we'd looked at. And he said, look, I think there's some mileage in this. So that's how me and Dr. Daniel Akarja set up Psynergy Mental Health. We now have 2 other neuroscientists from Cambridge University within the company as well. And yeah, so that's how Psynergy was born in October 2019.
Oh, brilliant. That was just before COVID.
It was, yeah. That was, we felt that it was a great time to set up a startup, and we went in there with loads of gusto, and 4 or 5 months, and then we just got ourselves an NHS research contract because they were quite interested in our approach as well, and some of the biomarkers and parameters that we were pulling out of the EEG. And then COVID hit in March 2020. So we signed an NHS research contract in March 2020, and COVID hit in March 2020. And that was it. Obviously, all research was stopped. Everything pivoted towards COVID. So essentially, a lot of our business, well, all of our business stopped. So we had to quickly pivot into producing other products, which is what we have done. So.
Okay, brilliant. And you were doing that while you were still working as a dentist, or was it your full focus from October 2019 onwards?
No. I've been I still work as a dentist now. I work even more now as a dentist. I'll always have Edge Dental. I love my team that work there. I love my patients that I see, and it's my core work. However, I do have a huge passion for trying to improve mental health for all, not just in dentistry. And my biggest passion lays in trying to normalize, that's not the right word, trying to reduce the stigma, but trying to get mental health more on the mainstream in terms of the way it's assessed. I think we should be assessing mental health in the same way that we have dental checkups, the same preventative model. And so by creating some of the tools that we've created, some of the digitech tools that we've created, we're trying to shift the focus to that way. But we need to get the research done behind it.
Brilliant. And because you were talking about the preventative model, I'm just thinking that, is it like, do you have, like, I think everyone faces some sort of mental, not illness, but some sort of depression or phases of depression, not long depressions or deep depressions. throughout their lifetime, multiple times. It could be smaller events, bigger events. So like, is it more of a proactive approach that you suggest, or is it more of reactive? Like, I know, I'm a bit depressed, I'm not happy, or I'm snapping at things, or other symptoms like that might come out. Like, is it more proactive or reactive, or like what's your suggestion, and is it a combination of both?
Unfortunately, a lot of healthcare in this country is reactive. It's reactionary, and we're fortunate in dentistry that we do take a preventative, proactive approach into try and manage oral disease. And I think you have to take that approach to all of your health, generally speaking, your physical health as well as your mental health. I think it needs to be done within mental health, but we need to have more research behind how to do that. Like you said, we all go through phases. We all have mental health all the times. I believe that we sit on a spectrum between being mentally healthy at times to then becoming mentally unhealthy, sometimes delving into mental illness, and then maybe coming back out of that to mentally unhealthy again. And we constantly, continually sort of bounce around the spectrum. And by having preventative approaches and by having approaches that will allow us to check in on our mental health, to try and prevent episodes of mental illness as much as possible, I think that has to be the way that we have to go, particularly within our profession, which is a very, highly stressful area, especially now transitioning out of COVID and the pandemic and stuff. It's become even more pressured and even more stressed due to access to dentistry. I'm quite fortunate because I work in the private sector, and we got up and running quite quickly through the pandemic. So I have no backlog of patients. But I also know that there's a lot of NHS practices out there that have a huge backlog of patients. And, every examination is not just a simple examination. Someone's coming in with a problem or whatever it may be. And that creates a huge amount of stress and pressure on the team. So having tools and preventative measures that can be implemented by yourself and your team to try and help keep you on track with your mental health is massively important.
Because you touched on the industry of obviously the dentistry, like where do you see, like, do all the professions face similar sort of, kind of stress which causes mental kind of illnesses, or, some sort of depression or anxiety? Or is dentistry, now my wife is a dentist, I'm not a dentist, but my wife is a dentist, and I've seen different phases. Now it could be when a patient comes in with a problem and you kind of take that baggage of problem at home, or you discuss emotional attachment with the patient and trying to understand if it's an old patient, or issues with the principal dentist, or with the staffing, or it could be anything. It could be monetary for NHS dentists. Yeah. So where does dentistry sit versus other professions in your personal experience?
I mean, we all know that dentistry is a very highly stressful environment. I think at the minute, the biggest profession that is struggling the most is vets. I think it has the highest suicide rate.
Just a quick message from our sponsors.
Introducing Smile Genius, the most powerful and intuitive all-in-one cloud-based treatment management platform. Smile Genius is up to 6 times cheaper than using the typical 5-6 platforms to complete a case. Every platform comes with its own subscription and monthly charges that weigh down your pocket, regardless of whether you make a sale or not. Smile Genius brings all those services under one platform, making your practice truly hybrid, saving you time and boosting your profits. From leads to loyalty, Smile Genius will assist you through your patient journey. It's an easy-to-use cloud-based platform which brings clinic, lab, and patient all under one roof. Work with any global lab or maybe add your own and get going. It also comes with a complimentary patient monitoring app to enhance your treatment success rate and referrals. Not only that, you can use the platform for any treatment, not just clear aligners. Visit www.smilegeniusdental.com to book a demo today and be a part of this smile revolution.
Unfortunately, I think dentistry is about third within that. Huge anxiety around dentistry, though, born out of the pandemic in terms of the people most at risk were the dental profession, generally speaking. I think 4 out of the top 5 professions at risk were dentistry due to the proximity to the oral cavity. That comes with its own stresses for people, or own health anxiety, for instance. You know, every industry has stress and pressures within it, of course, and everybody has stress and pressures, and you can never really say, well, one person stresses more than others, because it's all relative to that individual. And that's the whole point. The whole point about mental health and what we're trying to do is mental health should be treated in an individualized manner, exactly the way that we do with dentistry. We treat our patients according to risk assessments to disease. You know, the problem with mental health, the way that it's assessed at the minute, is that it's assessed subjectively, and it's almost like a blanket approach to treating it. So, you know, you'll see your GP. You might be feeling, like you say, down or unwell or mentally ill. You see your GP, you'll fill out a questionnaire, and more often than not, you'll leave with a prescription, and you'll be asked to have a review 4 weeks later, and they'll probably tell you to continue with the prescription that you've been given. It's a very much a one-size-fits-all approach. Well, mental health is not like that. What bothers you does not bother me. What bothers me does not bother you. You know, I get stressed about Liverpool Football Club and things like that. You know, some other people might not. You know, they might think, what's he talking about? He's off his head. So, you know, it's all relative. However, what we do know is that dentistry is an extremely high-pressured industry to work in. And I believe the biggest problem with dentistry, generally speaking, in particular on the NHS, but privately as well, is healthcare and targets do not mix. That's the biggest fundamental flaw to the system. So in NHS dentistry, we've got a huge set of targets to do to get our money, or to get paid, for the practice to get paid, so we can pay all the wages, etc. It just doesn't work. It doesn't mix from a healthcare perspective, and it puts a hell of a lot of excessive pressures on the personnel delivering that activity. And I think, you know, governing bodies, etc., out there need to understand that this has to change, and we've got a great chance to change this now. There's a whole new opportunity post-pandemic to press, you know, to press Control Alt Delete, you know, almost reboot the system and start again, and look at this to try and look after the very people that are delivering the healthcare system, you know, within dentistry. Private, you know, you mentioned before about wages in NHS dentistry. You know, private dentistry has its own problems and its own stresses that come. People think you're a private dentist, therefore you're automatically earning well. That's not the case. That's not generally the case, you know, and we have to remember that. You know, during the pandemic, for instance, it's probably the only time I've regretted selling my NHS practice, because NHS dentistry was backed. It had a guaranteed income. As a one surgery private practice, I was thinking, if my patients cancel their plans, I've not got a business. I've not got a team again. That comes with its own stresses. So everybody has their stresses, and everyone manages them in different ways. It's about supporting yourself and each other to get through those things, so you can try and build mentally healthy environments.
That makes sense, because you touched on the wages aspect, and I was just doing some research, and I was looking at the average hourly salary, because like I came from a non-dental background, like my graduation was engineering and so on. And if you check on Glassdoor, the average salary, again, it's more biased towards the associate dentist and earlier on in their career. I think it was somewhere around £50 an hour or something. It's so low. And we always think that it would be, you know, 200 to 300 pounds an hour or upwards. And that's the thing that's being sold, that, you know, if you look at any research, Gartner research, dental professions are number one, US dental professionals are number one, but the truth is far from those reports that you say.
It is, and obviously the US is a totally different market, totally different patient catchment, everything about it. It's all insurance based essentially, you know. But you're right. I mean, you know, it's one of the few professions that have probably, well, when you take into consideration now with the cost of living that's increased, you know, the average dentist probably earns less now take home than what they did 15 years ago, 10 years ago. Now, how many industries would say that? You know, and that's a huge factor on what's happening. And, you know, yes, we go to work, we're in a job that's a vocation, and we're there to help our patients, but also we want to get paid correctly. We want to earn a living. We want to provide the right type of lifestyle for our families and for ourselves, and the lifestyle that they deserve and that we deserve. So it's one of the few professions where I would say wages have decreased over time as opposed to increased over time. And again, this is what needs to be looked at, you know, or what gets looked at, or the parameters that measure success, and not necessarily the parameters that we would measure success by. And I'm not talking financial success. I'm talking about, work-life balance. I'm talking about, happiness and enjoyment and value within your workplace, going to work, looking forward to doing that job that you trained to do. We train so hard to become dentists, yet we're swallowed up within a system that's tough to work in.
Yeah. So how can dentists cope up with this pressure and this expectation of, just using the word expectation, to earn more or to take care of the family when the system is not supporting? Like, what are the tools and strategies that you teach through Psynergy that could help dentists? Yeah.
I can't fix the system, unfortunately, but what I can do is try and help you. I can try and help people to improve. One of the biggest things that's helped me personally is to talk and be open and show my vulnerability. I think when I set out on my journey to be a practice owner, I felt as though I had to be that person who had all the answers for everybody, who was sort of like the rock for the practice, really. People would come to me with their problems. I'd deal with them, try and help them where I could, and I'd never ever talk about my own. And I think over time that's probably taken its toll. I think one of the best things I can say to dentists out there, any dentists out there, is forget about this notion about you have to be the perfect boss. Forget about perfectionism. Is a huge problem in dentistry in general, in the work that we do. And that's another huge thing. I think we need to sort of let that go a little bit as well. We need to focus on the things that go well for us. I think too many of us focus on the 2% of things that go wrong, whether that be within your clinical work that you do, or whether that be in the way that, a member of the staff team has done a job and it might not have been perfect to your liking. I was terrible at this. I was really poor. If it wasn't done the way I wanted it to, I'd probably continue to do it until I got it right. I'm totally different now as a person. That just through learning and growing and having a growth mindset, it's important. And I think that just had a knock-on effect to my team as well. That they feel, that they've gained more autonomy through this. So I think the biggest thing is be open, honest, and show your vulnerability. I do it a lot during our staff meetings. We talk about things, that that get on our nerves, basically, and things that I do that are wrong. People will tell me and say, you know what, you did that and I didn't appreciate it. And I'm really sorry. I didn't realize I did that. Thanks for bringing that to my attention. Great. Brilliant. I'll try not to do it again. It's having that sort of creating that open culture where people can feel psychologically safe to say what they feel and see what they need. So I feel very safe now in saying to my staff, well, you know what, that hasn't worked for me as well, and this is what's not working. So can we look at improving that? So I think communication is key. I think another big thing, and one of the tools that we developed at Psynergy, was measuring workplace cultures. So measuring the mental health and well-being culture of the workplace. And we've created a tool specific for dentistry for doing this, which garnishes the opinions from all of your workforce, all of your practice team. They fill out an extensive mental health survey along the lines of key categories as stated by the Health and Safety Executive Management Standards. And this is all about managing psychosocial risk at work. Okay. To create a psychologically safe environment, you have to manage psychosocial risk. You have to. Okay. The only way to create a psychologically safe environment is to have statistics around how your environment is operating, and then create action plans to try and improve the operations of that environment, of that workplace, and then remeasure again. Okay. And hopefully over time, the idea is over time, you'll bank enough data for you to start to see these changes taking positive effects. Okay. So that's one of the major tools that we run in our practice, whereby we carry out 6 monthly surveys on mental health and well-being of the staff. We then use the report that's, and because of the process that we created in Psynergy, it's really easy to do this. It's very easy to capture the data. It's very easy to, the platform creates the report automatically. So it's an instant generated report. It's a real-time report as well. We then use that report to discuss our findings, which is a great way to open the conversation around mental health. because it's a hard conversation to open up. You know, how do you have these conversations? They're difficult. Where do you start? If you've got data in front of you, it's so much easier to open up the conversation to say, okay, this is how we are feeling as a practice collectively. This is what we scored in particular categories. We then break categories down into domains. This is what we scored in these domains. And also what our Pop Dental tool does is that it then gives you really easy, actionable suggestions to improve each domain. Now that's key, because it's not just a tool for gathering the evidence and gathering the data. It's then provides you with evidence-based research solutions that will allow you to then improve mental health and well-being within your workplace environment. And so that's what we do. And I've found that it's been a great conversation opener. It's really opened up the culture within our team, which was always very good. I'm fortunate in that I work with a very small team, which makes things a lot easier. And it also made things a little bit harder in terms of getting covered and that kind of stuff, but it made things a lot easier. I'm very fortunate in having a team that have embraced this and have become very open and honest. So I've learned about some key things around menopause, for instance, because one of my staff members is going through the early menopause. Really important. That's helped me in my own marriage, because we're at that age now when things are happening like that. So, you know, that's starting to help me in my own marriage and stuff, and starting to allow me to understand. And it's allowing me to grow as an individual as well, you know. I would definitely suggest for people to have, or practices to have, a structured approach in trying to improve their workplace culture. That's really important. Gathering evidence, acting upon the evidence, and then, you know, we gather the evidence again. It's a bit like a dental checkup when you think about it. That's what we do.
And when you say, when you talked about the open communication, because I'm just thinking that usually in the clinics, like if you have a 1 surgery or a 2 surgery, it's very small teams, like you mentioned. Mm-hmm. So how easy is it? Because usually the clinics and the dental system is that everyone is working in their silos. You have your surgery. The dentists usually do not talk that much. The only conversation you might have with your dental nurse, or maybe at the reception desk, and then you're off, if you finish early. So how do you, do you have these common gatherings or Monday meetings or time dinner, team dinners? Or how do you open up that conversation, and where do you open up that conversation?
Yeah. It's difficult for sure, you know, and again, this comes back to the situation of healthcare and targets don't mix, because we're such a target-driven industry that you can't take the time out to have these kind of meetings. But I think if we flip the script a little bit and we change the way that we think, you know, we bring mental health to the forefront of our staff meetings. You know, so you should be having your staff meetings, I'd say ideally every fortnight, but probably at least once a month. We bring mental health to the forefront of our staff meetings every time. So that's when we have that protected time where we're going to talk about all the things within the practice. And one of the first things on the list is mental health and wellbeing, and just discussing. And sometimes that could take, 5 to 10 minutes. Some people might not have anything to say. Sometimes it could take the entire length of the staff meeting and I have to book another one in, but so be it. Because one of the big things that I think that people should realize is that, just to give some statistics behind mental health and well-being, or poor mental health and well-being, costs the UK industry approximately 45 billion per year. Okay,
that's huge.
It's massive, absolutely massive. Okay, and approximately 30 billion, 29 to 30 billion is down to presenteeism. And presenteeism is when you come to work, but you're not 100% at work, essentially. You are probably 50, 60, 70% because you have other stressors or other distractions on your mind, okay? What it tends to lead to is a decrease in productivity. And what you'll then tend to get is burnout. So if we're going to talk about this preventative model, we want to try and prevent the decrease in productivity. We definitely want to prevent burnout, which is something that I've suffered with probably recently, and probably still am suffering with a little bit at the minute. But we want to prevent burnout, because burnout then is going to take a long time to recover from, and then you're in a real reactionary phase. Yeah. So whilst it looks like, you're spending an hour to talk about mental health, actually that hour is worth its weight in gold. Absolutely worth its weight in gold. They think that if for every £1 you spend you'll get a £5 return on investment. Okay. And if you implement programs that, and this is according to Deloitte, by the way, these are not just figures I've plucked out the sky. If you carry out group workshops, for instance, that's about £1 to £8. And the highest return on investment is doing personalized screenings, individual feedback, and then individual strategies. Okay. Now that's something that's the other part of our business that we're working on with the NHS, where we talked about the neuroscience side of things. That would very much come in a workplace package once we get the research behind it. But carrying out, workplace surveys, for instance, is a really, really good way to allow your people to give their opinion in a safe space environment, confidential safe space environment. Okay. And then for you to then act upon it as your team or management team or your senior leadership team. I would say the whole team, very easy for me. Again, I've already got 5 or 6 people that work for me. Very easy for the whole team to be involved. But in bigger teams, I understand that that's a bit more difficult. But ask everyone or as many people to get involved, to then start to shape the culture and start to drive that culture. It's everybody's responsibility at work to promote good mental health. It's not just the owners. It's not just mine as the practice principal. It's everybody's. I've got a responsibility to my own mental health and the mental health of the people around me.
And so how does someone know that they are suffering from some sort of mental illness? What are the indicators of that? Because I think a lot of people would just slowly burn until they burn out, as you said, and then realize, that is something not happening right. I need to see someone.
I think you're right. I think, as dentists, we understand the signs and symptoms of depression, anxiety, stress, etc. You touched on some of the symptoms before, where you get a bit more short-tempered with people, or you're constantly ruminating, or lack of sleep. Your nutrition might decrease, your lack of motivation. All these things start to come in and creep in, which, like you say, will eventually burn out. So I don't think we need to go into the full signs and symptoms of depression, anxiety, etc. I think the biggest thing is, coming back to what I said before, is being honest and open. Okay, but not being honest and open, being honest and open with yourself. It's not. It actually, people think we generally have been brought up in a society where we think that it's a weakness to talk about mental illness. Well, it's the exact opposite. The amount of strength and courage it takes for somebody to open up, to say, you know what, I feel as though I'm struggling here, and do you know what, mate, can you should we go for a pint and have a chat, because I'm struggling here. That takes a hell of a lot of courage to do, especially in a men's mental health situation as well. That takes a lot. It takes a lot for a staff member, an employee, to open up and say, you know what, I'm struggling with my workload. But again, if we flip back down to what we're trying to create here in terms of open cultures, what tends to happen is a staff member might be struggling with their workload. It could be a dentist, it could be a nurse, it could be whoever it might be. They're struggling with the workload, but they don't speak up. And then what happens is jobs start to get missed or don't get done to the best of abilities. And then that tends to create more work further down the line for the practice as a whole. Okay. And not only that, it then saps the confidence of the individual who hasn't done their job, and it might lead to their burnout, like you talked about before. If we can start getting this culture whereby people say, you know what, I need a hand here, I'm struggling, can you help me? Or I don't understand this, etc., whatever it might be. You're going to start to break down these barriers and start to create this psychologically safe environment that we spoke about, where people can speak up and not fear the repercussions of saying, or worry about they're going to think I'm stupid, or I'm thick, or I'm this, I'm that, etc. We want to start building those kind of cultures. So I think being open and honest with yourself, it's something that I've started to do a lot more. It took a long time to get there, I'm not going to lie. I've started to do a lot more, and I talk to my team quite regularly now. They'll say, how are you doing? I won't just give a standard responses, I'm fine. I will say that, actually, I'm struggling a bit this week. So I, just to give you a little story, I went to the Champions League final in Paris at the end of May, and I was caught up in all the crowd stuff.
Yep.
And it was a horrendous experience, absolutely horrific experience. So much so that it's put me off wanting to go to football, and I've been going to football for 40 years of my life. I've come into work and I've struggled a little bit the last couple of weeks, just in the aftermath of it, just trying to process things. You know, I feel quite fortunate not to have got injured. But then mentally I am, you know, there's the mental trauma that goes with it. So it's been difficult. It's been a difficult period. So, but I've discussed that with my staff. I've said to them, said, look, you know, I'm not in a great place at the minute. I apologize if I'm a little bit short, because this is one of the reasons why, and I'm not trying to use it as an excuse, but I'm bringing my whole self to work, and that's important. I'm letting people understand, look, this is me, this is what's happened to me, and this might not be a reason, or it might be reasons why I'm acting the way I am, but this is how I'm just feeling at the minute. Yeah. So that's massively important. I was honest with myself, and then I was honest with my staff members as well. So then they know and they understand, and then they will check in on me and say, how you doing? And sometimes I'll say I'm fine. I'm trying not to, but sometimes I'll say I'm fine. Sometimes I'll say, you know what, I'm struggling a little bit. Sometimes I'll say I'm good, which I am, you know. So and that's what it's about. It's about helping each other get through things. Not everything's just about work as well, you know. You can have the great place of work, but have turmoil going on at home, or vice versa. You know, some people go to work as a distraction. You know, some people can't wait to get home because work's the issue, you know. But without having those communications and having those honest conversations to ascertain these things, and then being able to help and support each other, how can you do it? You know, so that's the biggest thing I'd encourage is for people, if you want some evidence-based stuff, you know, at the start of COVID, on our website, we put up a free mindfulness course. I'm rubbish at mindfulness. I struggle with it. I struggle with trying to free my mind. However, there's a huge, strong evidence base around the benefits of mindfulness, for sure. And I still do try to practice it, because I believe that even if I can just manage to practice something for 1 minute, 2 minutes, 5 minutes, it's all building blocks. It's all stepping stones to create that sort of mental resilience, you know.
Yeah, because I think you talked about, you know, I think all the discussion revolves around the openness and communication and the honesty, not just with yourself, but also with the others, and opening up with what you are feeling. I think with more practice, you get used to sharing these feelings, because earlier it's like it had been difficult for me, because, you know, like if you are, and especially for men as well, I think it's like you don't want others to look as if you are weak, and that's how, yeah, culturally, like, I don't know, it's whether how much truth is there in that, but that's how everyone feels. And not to you may you know, share your feelings with your spouse, the max, and then with others, forget about colleagues. You know, you don't want them to look as if you are weak.
100%, and that's exactly the stigma we're trying to break down. And especially, you know, we spoke about men, and you know, you and I are both Asian. So like you say, there's cultural boundaries there as well that come into it, you know. And there's a huge amount of research about, you know, mental health or mentally unhealthful prevalence amongst ethnic minorities, etc. So, you know, it's the biggest killer of men under 45 is suicide, unfortunately. It's tough, you know, it's tough. And I think we do need to remember as well, as dentistry, generally speaking, is a female dominated world. More often than not, that's changing and it's shifting, because we're getting more and more males coming through as hygiene therapists and male nurses now, which is great. But it's generally a female dominated world. And so you tend to, as a male, you're expected to be the strong one at the practice. You're expected to be the one who's got it all together, sort of thing. And I think showing your vulnerability is huge. I think it really is. I think, you know, and like you say, once you do it, you realize that people don't judge you. You realize that, because one of the big reasons why we don't do it is because we're scared of being judged.
Yeah.
That's what it comes down to. We're scared of going, they're going to think that I'm weak. They're going to think that I'm silly. Or what's wrong with me? Just pull yourself together. You know, you should be able to handle this. All of those thoughts, all of those inner thoughts, that inner chimp, as Professor Steve Peters will talk about in the Chimp Paradox and whatever, as a book. That's a good book, by the way. Yeah, you know, all those things, all those thoughts, they try to capture your mind, because what happens is, when we're about to change, our biggest barrier to change is our inner thoughts and inner feelings, or because it comes right to the fore, because it's scared. It's a scared approach. It's automatically scared. Therefore, it goes, I don't want this change. So I'm going to try and do everything I can to try and stop you from changing. I'm going to do these things. Once you start stepping outside your comfort zone and you start doing these things more often and more often and more often, it becomes so much easier, like you say. And the benefits are massive, not just to yourself personally, but holistically amongst your entire team or your marriage or your family or wherever it might be. The benefits are huge. They really are. And you'll start to see those benefits, and hopefully it'll encourage people to speak up more.
Brilliant. So you mentioned about the book, The Chimp Paradox. So in your personal one, like what kind of books, or let's say outside of your company, like what are the things that you use? So let's talk about one podcast, one book, maybe an influencer that you follow. Who are they?
Right. I'm not the best at reading, but I'm going to find you a book. 1 second, I'm just looking up now. One good book that I'm just looking at my bookshelf now. One good book is The Power of Now by Eckhart Tolle.
Eckhart Tolle, yeah.
That was really good.
Yeah, that's right.
I'm a big fan of the Chimp Paradox. A very unknown book is called Off the Wall, which is written by an ex-basketball player who talks a lot about mental resilience. And his name is John Dabrowski. It's a very easy read as well. And I found a really easy book, and I cannot for the life of me remember it's a very easy read. And if you bear with me, I'm going to just find you out the name. It's about cheese, right? I don't really listen to many podcasts, although
Who Stole Your Cheese, is it? Or something like that?
It's cool. I'll tell you the exact title. It's really good. Have you read it?
I have, yeah.
About the mice?
If that's, yeah.
What's it called? The Story of Cheese?
I think it's called it's called Who Stole My Cheese?
Who Stole My Cheese? That's it. Yeah. Fantastic book.
It's a fantastic book. Yeah.
Fantastic book. Really easy. Talk about reframing thoughts, etc.
That's right. Yeah.
And looking at things from different perspectives and going out and stepping outside your comfort zone, but written in a very easy way. I'm
easy
not
to understand.
Reading, much to my wife laughs at me because I'm not the best at reading. I found that a really easy book to read. Very good book. Yeah. So yeah, thanks for reminding me of the title. Podcast wise, listen to a few of Diary of a CEO. There's some of that's quite good. But no, I think Who Stole My Cheese? That's it, isn't it? Yeah. I think that's probably one of my favorites. That as a book. Yeah. And
any influencer or someone that you listen to quite a lot, or a mentor of yours, if that's something in your personal life?
Honestly, no. If I'm honest, I listen to so much stuff around mental health and positive psychology, and I spend a lot of time researching. So, obviously with the work that we're doing, and we're trying to get our research off the ground, we have to spend a lot of time researching. So it goes hand in hand, really. So I don't really have, I would say, a favorite influencer or mentor per se on this. I've sort of done a lot of it myself, if I'm honest, just from reading and researching and trying to understand. There's lots of, models out there that can help, like I say, trying to look at mindfulness. I think there's a lot of people out there who are doing some fantastic work within mental health. Ruby Wax, for instance, brilliant in what she's trying to do and bringing that. And she's a big mindfulness advocate. Jay Shetty, obviously very well known, always very positive in his approach. But I don't personally have any, sorry, I'm not as cool as you guys are with social media and that kind of stuff, and having social influencers. Within dentistry, there's lots of good people that I've met within dentistry who are trying to be very positive. I'd have to give a massive special mention to Andy McLaughlin and Nikki Rowland from the Exceptional Leadership Academy, who is they're always really positive, trying to improve cultures within workplaces, trying to help people manage that. Someone who I follow on Instagram, I don't know her, but I think she's very good, as Dr. Rona Iskander. I think she's really, really good. And a massive mention to Practice Plan as well, who were one of the ones who invited us down to do the talk, myself and Dr. Margaret Kwaja, who's fantastic in the work that she's doing with the Mind Ninja. Practice Plan have been a fantastic company to work alongside, and I'm not a practice plan dentist, but I've been really impressed with their ethos and the way that they've gone about things. It's not all about financial gain, it's about doing the right thing with them, and I think that that's really important. So yeah, big shout out for them, those people within dentistry who are doing that kind of stuff.
Brilliant, great. And before we wind up, last question. What has been your biggest learning or lesson to date?
Oh, wow. Have you got all day? Lessons. Constantly learning lessons. I think not trying to do everything myself.
Mm-hmm.
So delegating tasks, accepting that tasks can be done in different ways and not just the way I want them to be done, I think is a huge, huge learning thing that has really helped me personally. Giving autonomy to people to do things. You know, those are probably some big lessons that I've learned the hard way, where I took on too much, trying to be everyone's mate, trying to help everyone where I can, and I'm a human just like the next man, and I just you can't do it. And I think, you know, we've spoken about it a lot. The biggest lesson is it's good to talk, basically. Be open, honest, be authentic, have conversations, speak from the heart, you know, help each other, treat people the way you want to be treated. It sounds so cheesy, but it's absolutely massively true. They're the biggest lessons I've learned over my time. I've started to open up a lot more. I'd never have done something like this, you and I chatting, and me talking quite openly about my own mental health. I've never done this 5 years ago, never. So that's a big lesson, I think.
Brilliant. I think that's one of the lessons that I took as well, because, you know, you think that you have to be open, but you don't. It goes to the subconscious mind, and you don't actually practice being open, and then that being judged, you know, aspect takes over every time.
I think one of the ways that have sort of helped me become more open, and I'm still working on it. It's not always a walk in the park. You sort of default back to your original settings, don't you? You know, where you start to close off a little bit again. Is I've just mentioned that word authenticity and being true to yourself. I think as any individual, I think they're two real core values that I think that should be embraced. And therefore, then, if you're not going to be open, and it'll take time, but if you're not going to be open, and you're not going to be, if you're not going to be open, you will not then be authentic. You will then not become being true to yourself. If something is bothering you, we should be able to have a society whereby we can tell people what's bothering them and what's not. We should be able to say that without fear of, you know, this is going to end in an argument, or this is going to be taken the wrong way. It has to be said in the correct manner, respectful and politeful at all times. But we should be able to do that. Set boundaries. That's another really good tip. You know, I used to be the guy that I was a reflex yes kind of guy. Someone asked me to do something, yeah, no problems, I'll do it. And I'll just have it on my list, and I'll be sat there about 10 minutes later thinking, I've got another 30 things to do. Why have I just said I'll do that, you know? And so it's on my list. I'm now stressing about that as well. You know, set your boundaries, not just in jobs or tasks, but in terms of the way people communicate with you. I'm still working on that. It's something I don't do very well, but I want to do better. So yeah, I gave you about 5 lessons there, sorry.
Right. More the merrier. Great. Thanks, Rick. I think this was an absolute pleasure, and I think a lot of great insights, and especially the tactics and the strategies around being open, authentic, and sharing with people, communication, as you said, not just in your personal life but also in your professional life. I think that's something that people can straight away take this as a takeaway. And do you want to talk to the audience, like where they can find you, and if they were to attend, any of the courses? I'm assuming it's for individuals as well as for organizations. Do you want to talk about that, please?
So we don't actually offer courses. We offer product and the biggest product that we offer at the minute to the public is our tool known as the POP Dental. The POP stands for Synergy Objective Program. So for dentistry, and that allows you to measure the workplace culture of your dental practice. So it's the tool that I talked about, where it'll gather all the stats for you and it'll give you suggestions on how to improve things. So it'll give you an action plan essentially, and then you can then come back in and remeasure workplace cultures. You can find us on www.synergy, that's with a P in front of the word synergy, synergymentalhealth.com. Or you can email me at ritesh@synergymentalhealth.com. Again, that's with a P in front of the synergy.
Great. Thank you. We'll put everything in the show notes. So thanks, Rick. Thanks for your time.
Thank you so much for your time. I really appreciate it.
Thank you. Cheers.
I hope you enjoyed this podcast. Please like, share, and subscribe, and visit SmileGeniusDental.com for more great podcasts, blogs, and everything Smile Genius.